dispatched for an ancient lady that has some respiratory distress.
Oh, no. Okay, got my dispatch. Ancient lady really is like 32 or something. So I'm ready to go. I'm gonna go BSI is my scene save.
It is.
Okay, I'm gonna walk up. I'm gonna start my snack portion. So scene safety, nature of illness is respiratory. Number of patients, I just see the one. Lovely. I'm gonna put ALS on standby and I'm gonna consider C-spine. Given that it's for respiratory, I don't think I need it right this second. So I'll come in, I'll get my general impression. What do I see? Oh no, she's tripoding. Oh no. Okay. Hi ma'am, my name's Amanda. I'm with EMS. How are you today?
I'm just fine.
Oh, that's lovely. All right, I'm sorry. I'm a really bad actor. So I'm gonna start doing my level of consciousness. That's why I'm talking to her. I'm like, all right, so my name's Amanda. What's your name?
Ethel.
Ethel, such a lovely name. Nice to meet you. Why did you call me here today?
Well, I was watching the birds and I saw a rare one and I got excited and I can't breathe.
Yeah, do you know where we are today, Ethel?
I'm in the nursing home.
Okay. And do you know what year it is?
2025.
Beautiful. So she knows where she's at. She knows the year. She knows why she called me. All that good stuff. So I already did my chief complaint with that. So I'm going to go into my ABC. So I'm going to just go ahead. She's talking to me. I'm assuming your air's waves patent. But I can still look. Everything good? Will you
There's
open your mouth for me?
popcorn in my
Okay.
mouth.
Never mind. But it's patent?
Yes.
Yeah.
Lovely.
I get into breathing. I'm just kind of looking here for rate, rhythm, quality. Does she seem like she's struggling? How is it? Seems kind of slow and shallow. Is it adequate or inadequate?
It is adequate.
Okay, lovely. I'm also gonna put my little pulse ox on just because I can. Where's my pulse ox read?
93.
Oh no. All right. Well, I like nasal cannulas. What if I put you on a nasal cannula at 6? Does she tolerate
Patient
it?
tolerates.
Okay, and I'll check later to see if I need to up it with that. And then I'm gonna go ahead and check my circulation. I'm just gonna grab your hand here, Ethel, feel real quick. Feeling for 10 seconds. What do I feel?
Regular, slightly rapid.
Okay. And how about her skin? Is it?
I'm just always
I
freezing.
know it's like I'm cold too. I'm sorry.
It's pale, warm.
Pale, warm. She's not sweaty or anything though. All right. If I needed to, I could. You know, if she said she wasn't feeling great, I could offer her a blanket, but it's not super pertinent, I would think right now. And then I would obviously assess for any major bleeding, but I'm assuming I don't see any. I'm gonna say, you know what, Ethel, given your ancient age that you gave me and the excitement of the birds, we're gonna go because in our scenarios, if you transport, you're not wrong. And then once I'm in the back of the ambulance, before I leave, I'll be like, hey, if you have any meds, we'll grab everything, da 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 da.
I got an inhaler.
Perfect, because I'm taking so long to get to it. So we're gonna go in, I'm gonna start doing my ample history, right? So I'll say, okay, I know you have an inhaler for medications. Do you take any other medications?
No.
No? That's lovely. Okay, great. And then do you have any allergies to anything, Ethel?
Shellfish.
You didn't eat any shellfish today, did you?
No.
Okay, I'm just double checking. So that's your AM. P is passport and medical history. So you said you had an inhaler.
I got the COPD.
Oh, you have the COPD. Noted. How long ago were you diagnosed with that? That could be a clarifying question.
14 years ago.
Wow.
I've been smoking since I was 12.
That was my next question. Yeah. Do you still smoke, Ethel?
Sometimes.
Sometimes, but a little bit less now, just for funsies.
Yeah.
Okay, perfect. The L is your last oral intake. So you didn't eat any shellfish today, but did you have breakfast or anything?
I had some Jello.
Yeah. Was that pretty recent or was that
2
early
hours
this
ago.
morning? Okay. You feeling okay? Do you want some food? We can try to arrange stuff.
I'd like a
Attending.
cool glass of water.
Lovely. I'll find my other EMT who's a baby EMT. And then, so last oral intake, events leading up to, you said you were looking at some rare birds.
I just got excited
Yeah?
and I couldn't breathe. I got antsy.
Has this happened to you before though?
Oh, I always when the birds come.
Especially with the birds, that makes sense. Makes your heart flutter like their little wings.
I just
Um,
love
Just love it. And the onset for this, which again isn't when did this happen, it's like did it come on fast or slow?
it. It was fast.
It was really fast. Okay, perfect. Let's see here. And then does anything make this breathing a little bit better or worse for you?
I like to sit up. I don't like to lay
Yeah.
down.
Did you try laying down and it made it worse than I
I don't like it.
You don't like it? Did you move around at all? Just sitting like this is good?
Yeah.
Okay, and see, those are more clarifying questions for that. So, can you talk to me a little bit about your difficulty breathing? Is it painful or is it? what's
No,
feel
it just I
like?
can't catch my breath.
Yeah. Okay. Does it feel tight or anything?
No.
Okay, and that's the quality, right? And does it just stay in your chest, or does this discomfort of not being able to breathe move anywhere outside
It's
of your lungs?
just in my chest.
Okay, perfect. So again, we're hitting all the points. So when this has happened in the past, is this worse than it's happened before?
Oh, it's
or-
about the same.
And what do you think you'd rate that on a scale
Like a
of 1 to
5.
10? Okay, and what's your worst pain ever? You seem pretty tough and cool. So
8.
Your worst ever was an 8. What happened there?
I was bit by a dog.
I don't know. I'm just asking. Okay, and then how long ago did this happen?
20 minutes.
Right, you did say that, my mistake. Noted, 20 minutes ago. So I'm gonna go ahead, I'm gonna start my vitals for her, so I'm gonna reassess my pulse ox. How's she sitting with that right now?
96.
Oh, that's good enough. Cool, so I'm not gonna adjust it, she's at 96%. I'll get my blood pressure. I'm not sure I remember these.
138 over 72.
138 over 72, that's not bad. How about my heart rate?
106.
106, okay. Oh, this is not working. And my respirations.
22.
22. And are they still seeming kind of labored or shallow or anything? Does the oxygen seem to
struggling a
help?
little bit.
A little bit? Okay, well, we're getting into that. So I'm gonna move into my secondary here because we're doing everything by the book. I'd have her take her blouse off or whatever else and say, hey, Ethel, I'm just gonna listen a little. There's a
Okay.
few options. You could have her lean forward since she's already there. You go apex, apex, base, base. You could check over here underneath their armpits. If she was laying back, we could also check here. It just kind of depends. Do I hear anything upon auscultation?
Here's some expiratory wheezing.
Of course I do, because you're having a nose issue, potentially your CBD. If I wanted to take it a step further, I could also palpate. I could kind of walk down here. I could feel. I don't like pushing her. Do I feel anything over here? Your chest wall seems intact. I think you're not
Intact
just
and
getting
stable.
points. Lovely. All right, Ethel, can I see that inhaler we grabbed because we're so great and we've taken forever? I'm going to verify my 5 rights. This is you. What's your date of birth, Ethel? Yeah, it matches.
Yeah.
Right dose, right time, right person, right medication. Since this isn't something I can give on my own with my standing orders, I'm gonna call up my Meadow. I'm gonna give them her vitals, 138 over 72 blood pressure, 9602 on a 6-liter nasal cannula, 106 for her heart rate, 22 for her respirations. She has a history of COPD diagnosed 14 years ago. Can I assist? And he'll say, send it. I go, all right, Ethel, have you taken this before?
Yes.
You know what you're doing then?
Yes.
Okay, here you go. If it has space, I could give it. Go ahead and hold it as long as you can. I'm gonna document the time at 15:33 that I gave it to her. Other than that, Ethel, just relax. We're just about there. Given that this patient isn't super critical at this moment, I'm gonna reassess every 10 to 15 minutes. Just make sure. Hopefully she'll start feeling some relief soon. Beep, beep. You arrived at the hospital. I'm gonna give my hand off. All right, that's your missed, right? So mechanism of injury. I have a ancient woman complaining of difficulty breathing, like she said. Her injury is the respiration. There's really not much with that. Past history of COPD, was prescribed an inhaler 14 years ago. I heard wheezing on exhalation with my auscultation. And then that's like really the signs and symptoms portion. And then treatment, I helped her with her inhaler at 15:33. It appears to have alleviated symptoms ever so slightly. Her pain went from maybe a 5 to a 4 because I would have asked that. I'm not just making it up. And then I would also point out, I put her on a nasal cannula at 6 liters per minute. Patient tolerates. Do you have any questions for me? And they'd say, no, get away from me. And I'm gonna leave. And that's it. Did I miss anything? Cool.